Welcome to my channel. She was the invisible one in the OR, just the instrument nurse, barely acknowledged, never asked. But when a young mother's life hung by a thread and the entire surgical team froze, 5 quiet words from her changed everything. What followed wasn't just a rescue, it was a revolution. You ever been in a room so silent it makes your ears ring? That's what I remember most about that night in the OR. Not the screaming monitors, not the panicked voices. No, it was the silence after I said 5 words. But I'm getting ahead of myself. My name's Evelyn Holt. I'm 31. Been working as an instrument nurse at St. Marlo's Hospital in Chattanooga for the last 6 years. The folks around here don't say my name much. That's not bitterness talking. It's just the way it is. They call the residents by name. The surgeons, always. Me? I'm the nurse on instruments, or someone get the meds from her. That's about it. I don't mind. I'm not in it for attention. I show up early, I prep the trays, I stay out of the way. No one notices if I eat lunch alone. I guess it's easier that way. St. Marlo's is the kind of hospital that runs on hierarchy. The rules are carved in stone, and no one likes surprises. Dr. Whitaker, the chief of surgery, once said during rounds, "Support staff is here to support, not to think." That tells you just about everything. I've been called fast, efficient, thorough. Dr. Mira Kellerman, one of the senior residents, once joked I was weirdly psychic, with how often I handed her the right clamp before she even asked. Dr. Cam Bryce, another attending, was less kind. Just because she knows how to pass a tool doesn't mean she understands the medicine. I heard him say that once, right to my face, without realizing I was standing behind the curtain. Thing is, they weren't entirely wrong. My badge says nurse, not surgeon, not MD. But sometimes people forget that knowledge doesn't ask for permission before it lands inside your head. And mine? Well, I've got more in there than most folks would guess. I never told anyone about the pages of surgical journals tucked inside my locker, or the old anatomy textbooks I still read on the bus ride home. Never talked about the years before St. Marlo's, the 10 hospitals, the things I saw when there wasn't time to label who was qualified and who wasn't, only who was still breathing and who wasn't. But all that came flooding back one Tuesday evening. The case was a young woman, 25, maybe, pregnant, ectopic rupture. She was barely holding on when they wheeled her in. Dr. Whitaker took point. 2 residents flanked him. I was stationed to his left, as usual. Tray ready. Hands steady. He gave me a glance before we started. "Nurse Holt, keep to your lane. Just instruments." I nodded. Didn't even blink. I'd heard it a dozen times. At first, things looked manageable. The bleed was worse than expected, but they moved quickly. 10 minutes in, though, something changed. The blood came faster. Thick, dark, and heavy. It filled the cavity so fast suction couldn't keep up. Dr. Kellerman tried to clamp a vessel near the iliac, but her hands were shaking. "I can't see anything," she muttered, voice rising. "There's too much." Dr. Whitaker leaned over her shoulder. His hands moved quick, but wrong. Wide movements when the field needed precision. I watched as the rhythm of the room shattered. I could see where the bleeding was coming from. Not the vein they were targeting, but a lateral branch off the uterine artery. I knew what needed to happen next. Every fiber in my body screamed it. But they hadn't asked me, and I knew what would happen if I spoke up. I tried anyway. "Doctor," I said, soft but clear, "you might try a rotated compression suture. Redirect the flow away from the..." He cut me off without looking up. "Nurse Holt, pass the damn tool and stay quiet." The resident next to him shot me a glare. "You trying to get fired?" I bit down the words. Stepped back. Watched. 2 minutes passed. Blood kept coming. The patient's vitals dropped. The monitor screamed. Dr. Kellerman fumbled. And then it happened. The incision widened under the pressure. Tissue gave out. Suddenly there was no field, just a blur of red. "We're losing her," someone yelled. I looked around. Everyone was frozen. Panic had snapped the OR in half. The surgeon, the residents, even the anesthesiologist had stopped moving. And that's when I stepped forward. I didn't ask. I just reached out, wrapped my hands over Dr. Whitaker's, and steadied them. Not forcefully, not angrily, just calm, like I was guiding a child's hands on a piano. Then I said the only thing I could. "Clamp. Rotate. Pressure. Now trust." For the first time in 10 minutes, the room went still. I didn't expect them to listen. Not after all the times I'd been brushed off, talked over, reminded of my place. But something about that moment, maybe it was the desperation, maybe it was the tone of my voice, or maybe it was that deep down part of them that knew they were out of their depth, made everyone freeze. Dr. Whitaker didn't speak. His hands, still gripped in mine, paused mid-motion. He looked at me for the first time that evening. Not through me, at me. I met his eyes. And then he nodded. A tiny, almost imperceptible movement. He rotated the clamp, just as I'd guided. I motioned to Dr. Kellerman to adjust the retractor. She obeyed without protest. One of the scrub techs followed my finger as I pointed to the exact pressure point on the outer pelvis. 10 seconds later, the bleeding slowed. The monitors stopped screaming. It wasn't over, not by a long shot, but the storm had cracked just enough for us to see the path out. And from there, the team moved. Not panicked, not flailing, working. Whitaker found his center again. Kellerman stopped shaking. The anesthesiologist gave a thumbs up as the vitals stabilized. The team carried the patient through the rest of the operation with steadiness I hadn't seen since we began. When it was over, the woman was still alive. Her baby too. As the O.R. emptied out and the hum of normalcy crept back in, Dr. Kellerman lingered near the door. Her voice was quiet, like she wasn't sure whether she wanted an answer. How did you know what to do? I didn't look up from the tray I was resorting. I learned it a long time ago, I said. In a different kind of room. She waited, like she expected me to go on. I didn't. The silence stretched. You weren't guessing, she finally said. You knew. That wasn't nursing school knowledge. That was field trauma work. I paused, and for a brief moment, I let the memory come back. A white canvas tent, the smell of antiseptic and sweat, voices in a dozen accents shouting over one another. No monitors, no suction, just gauze and hands, and the will to keep someone breathing one more minute. 15 years ago, I said, somewhere far away. The first time I used those techniques, we didn't have backup, or gear, or time. We had people bleeding out in the dirt, and the choice to try or watch them die. Kellerman just stared at me. Where was that? Doesn't matter, I said, standing. What matters is the woman on that table gets to see her kid grow up. She didn't press me further, just nodded once and left. The next day, things were different. Not on the surface. No parades. No plaques. I was still in scrubs, still prepping trays at 5:45 a.m. like I always did. But people looked at me a little longer now. Dr. Whitaker, usually too busy to acknowledge anyone without a badge that started with MD, glanced my way twice during rounds. Didn't say anything, but I noticed. It was strange. Even stranger was what I found later that afternoon, tucked into my locker. A piece of paper. No name. No handwriting I recognized. Just 5 words. You saved her. We saw. I stared at it for a long while before folding it neatly and slipping it beside the other note I kept taped inside my locker door. That one, written in my own hand years ago, said, no need for credit. Just need them to wake up. That night, I stayed late to catch up on inventory in the surgical storage room. I liked the quiet, loved it even. It was the only place in the hospital that didn't hum with ego and expectation. Just shelves and instruments and stillness. As I was logging the scalpels, Dr. Whitaker walked in. He looked older than usual. Tired. Not physically worn. Like something inside him had shifted. I read the surgical notes, he said. You weren't listed. Not the way you should have been. I wasn't supposed to be in the decision loop, I replied. You said it yourself. He nodded slowly. I was wrong. He leaned against the doorway, studying me. I've been doing this job for 30 years. Trained at Johns Hopkins. Seen things I still wake up sweating from. But yesterday, in that room, I froze. You didn't. He paused. And that shouldn't have happened. But it did. Because you understood something we didn't. I didn't answer. Just let the silence fill the space between us. Finally, he asked, where did you learn that? The lateral suture rotation? The clamp placement under full arterial flow? That's not in any textbook I know. I could have lied. But instead, I told the truth. I was in Haiti. Earthquake relief camp. Port-au-Prince. I was a third-year med student, on rotation with a Red Cross team. One night, a truck flipped bringing in supplies. 6 patients, 2 of us. The doctors had gone north to assess structural damage in the city. You were alone? I nodded. Everything I learned that night, I learned the hard way. And when I came back to the States, I couldn't finish med school. My paperwork got lost during the visa renewals. By the time it cleared, my window had passed. No programs would take me. So, you became a nurse. I needed to stay close to the work. That's all I've ever cared about. He didn't speak for a long time. Then he said, quietly, I'm sorry. For what? For not seeing you sooner. You'd think a moment like that would change everything. That after someone like Dr. Whitaker says they were wrong, the skies part and things start to shift. But hospitals don't turn on a dime. Culture runs deep, like tree roots you can't see until they crack the foundation. The next few days passed in a strange kind of limbo. Most of the staff went back to their routines. But something unspoken had settled over the surgical wing, like a question hanging in the air no one quite knew how to ask. Dr. Kellerman started stopping by my prep station more often. Not to make small talk. She wasn't that kind of person, but with little things. Clarifying an instrument type. Asking for a second pair of eyes on a tray layout. Once, she lingered just long enough to say, how would you manage a double basin bleed with no imaging? I gave her 3 options. She said nothing, just nodded and walked away. But I saw the corner of her mouth twitch on the way out. The beginnings of a smile. That was enough. The nurses started noticing, too. Tasha, new, eager, still wide-eyed from school, pulled me aside one morning while we were scrubbing in. Can I ask you something? She said, glancing over her shoulder. Sure. How do you know? I mean, before things go wrong. The way you moved in that night. It was like you already saw it coming. I paused, wiped my hands on a towel, looked her square in the eye, because I've been in rooms where there was no one else to step in. She blinked. But you're not a surgeon. No, I said, but I've held lungs together with my bare hands and kept hearts beating with pressure and prayer. You don't forget what that looks like. She didn't know what to say, but she nodded, slow and thoughtful. And that's how it started. Quietly. No announcement. No meeting memo. Just a group of nurses and 1 or 2 residents who started meeting in the break room after hours. At first, it was 5 of us. Then 10. Then more. No PowerPoints. No handouts. Just a whiteboard, some models, and whatever knowledge I had to give. I'm not here to teach you what's in your textbooks, I told them. I'm here to teach you what to do when the textbooks fail you. We practiced emergency clamp placement with rubber tubing and mock bleeding systems. I showed them how to read blood loss in real time using skin color and responsiveness instead of monitors. We ran mental drills on how to stabilize a patient when the power cuts out, and the only thing left is your instinct. One night, Tasha asked me, how do you stay so calm when things are falling apart? I thought about that for a long second. Panic spreads, I said, but so does calm. If you hold your center, others will start to find theirs. That's how you bring a room back from the edge. A month after the emergency, something unexpected happened. Dr. Whitaker approached me in the hallway. He wasn't wearing his usual guarded expression. This time, he looked almost human. We're updating our emergency response protocols, he said, rubbing the back of his neck like it was the first time he'd had to admit something new. Dr. Moore, the chief of staff, read your notes in the post-op report. The part about clamp, rotate, pressure, now trust. She wants to integrate that sequence into training for high-risk surgeries. I didn't say anything, just waited. She says it cuts through panic better than anything we currently use. Creates cohesion. Focus. You mind if we name it the Holt protocol? That caught me off guard. I didn't write it for credit, I said. I know, he replied, but it's saving lives already. You might as well own it. I shook my head. It belongs to the people who use it, not to me. He smiled, just a little. That's exactly why it should. The ripple effect came slowly, but it came. Nearby hospitals caught wind of the new protocol. They started asking for training copies. Residents began quoting it during trauma drills. And more nurses, people who had always felt like background noise, started stepping forward in emergencies, guided not by fear, but by clarity. But that wasn't the part that mattered most to me. No, what mattered came on a quiet Friday morning when a woman walked into the surgical wing, cradling a newborn in her arms. She was the one from the operation, the young woman whose life we almost lost. She asked for me by name. They paged me over the intercom. I nearly dropped a tray when I heard it. I stepped into the waiting room, still in my surgical cap and gown, unsure what to expect. She stood, smiling, tears in her eyes. This, she whispered, motioning to the baby girl in her arms, is because of you. I stared at that child. She looked strong, healthy, alive. I swallowed hard. I just helped, I said quietly. No, the woman said, shaking her head. They told me everything. They said you saved me. And her. I didn't have the words. Not then. Maybe not ever. But something settled in me that day. Something that had been restless for years. After she left, I went back to the break room. Sat there for a long while, hands still trembling a little. Not from adrenaline, not from fear. It was something quieter than that. Like a thread inside me had finally stopped pulling taut. The photo she gave me, just a small 4x6, now lives inside my locker. It's tucked behind the same old note I've had up for years. No need for credit. Just need them to wake up. I added a second slip of paper next to it that morning. Just one word, alive. And that's when I realized something had changed. Not in the hospital. Not even in the people around me. In me. I didn't feel invisible anymore. Things started to happen quickly after that. One afternoon, Dr. Moore, the chief of staff, called me into her office. She'd always been polite to me in passing, but this was the first time I'd ever been summoned directly. She gestured for me to sit. Evelyn, she said, her voice as calm and measured as ever. I've been reviewing the incident reports from the ectopic rupture case. I've also had more than a few of your colleagues pull me aside to talk about your role that night. I didn't say anything. I wasn't sure where this was going. Dr. Moore leaned forward slightly. I think we've underestimated what you bring to this hospital. I opened my mouth to reply, but she held up a hand. I'm not just talking about skill. I'm talking about presence, leadership, decision-making under pressure. These are things we try to teach and still fail. But you do them. Consistently. Quietly. Still, I stayed silent. We'd like to offer you a position as a clinical instructor for our nursing team. You'd lead emergency response workshops, participate in surgical simulations, and, if you're willing, train residents in trauma protocol. I blinked. Of all the things I'd prepared for that day, this wasn't on the list. I'm not interested in being promoted for one moment of action, I said. That's not what this is about. Dr. Moore nodded slowly. Then let's make it about all the moments no one saw. The years you carried this hospital without recognition. The insights we overlooked. The students who already come to you without being told. That hit harder than I expected. You're not just a steady hand, Evelyn. You're a compass. We need people like you guiding the next generation. I walked out of that office with a folder in my hand and a very different weight on my shoulders. I didn't accept the official role, not at first. Instead, I made her a counteroffer. Off-the-clock sessions, held during shift changes. Anyone could come, nurses, techs, even residents. No hierarchy, no pressure. Just hands-on training for when it all goes wrong and the protocols break down. By the third week, we were running out of chairs in the break room. I taught them everything I'd learned the hard way. How to feel for a dropped pulse when the monitors lie. How to recognize internal bleeds by skin tone alone. How to quiet the panic in your own chest so your patient doesn't feel it in theirs. The phrase caught on faster than I expected. The same 5 words I'd used that night. Clamp. Rotate. Pressure. Now trust. It started as a mantra, a way to settle hands during chaos. But it became more than that. A mindset. A method. Some residents taped it to their clipboards. I heard one intern mutter it like a prayer during a tension pneumothorax case. I smiled when I passed him, though he didn't see me. Dr. Whitaker, of all people, started referencing it during debriefs. This isn't about ego, he told a fresh batch of residents. It's about clarity. That's what Nurse Holt gave us that night. A compass in the dark. The hospital changed after that. Not overnight, but meaningfully. People started listening to voices they'd ignored before. Nurses began speaking up more confidently. Residents asked the cleaning staff if suction was working right, instead of assuming it was. There was less shouting during code blues. More eye contact. More trust. It felt like the whole place had exhaled. But the biggest shift came one morning when I arrived early and found Dr. Bryce. Yes, that Dr. Bryce, waiting by the nurse's station with a folded document in his hand. He cleared his throat awkwardly. I reviewed the trauma response simulation you ran last week. Impressive work. Better than what we get in half the med school curriculum. I didn't know what to say. He handed me the paper. I'm nominating you for an internal commendation. And I've recommended your session be added as an elective to the emergency medicine rotation. I took the paper slowly. And one more thing, he added. If you ever do decide to pursue formal teaching, surgical instruction, I'd back that application in a heartbeat. I didn't smile. I just nodded. That was enough. Word travels fast in a hospital, quicker than blood through a blown artery, if you'll pardon the analogy. Within 2 months, the sessions I was running after hours had become the worst-kept secret at St. Marlo's. People from other departments started showing up. ICU nurses, ER techs, even a few OB residents. One night, I spotted a lab tech in the back, still in his smock, just listening with his arms crossed. Nobody asked for permission anymore. They just came. I never raised my voice. I never stood at the front like a teacher. I spoke from the table, hands on, sleeves rolled up. This is how you find a bleed without imaging, I'd say, pressing on a mock torso rigged with pressure bladders. Here's what liver rupture feels like. Here's what peritoneal swelling looks like without a screen to tell you. Every once in a while, someone would ask, "Where'd you learn this?" And I'd just say, in places where people didn't have the luxury of dying slowly. They usually didn't ask twice. The only one who did press me was Dr. Moore. She found me in the cafeteria one quiet afternoon, a tray of soup in my lap and a folder of notes I'd meant to read during lunch. She sat across from me without asking. That was her way. Confident, direct, but never aggressive. "I talked to Dr. Lee," she said casually, like she was commenting on the weather. I looked up. "Ray Lee?" She nodded. "He said he recognized your technique. Said you were the med student in Carver Base back in '09, during the fuel depot bombing." I froze. That name, Carver Base, hit like a steel tray dropped on tile. "You were the one keeping patients alive with pressure and tourniquets," she continued. "The only one left after the evacuation." I stared at my soup. 14 people, she said softly. "That's how many they said you saved." "I didn't save anyone," I said after a moment. "I gave them a chance. Some of them made it. Some didn't." Dr. Moore leaned back in her chair. "You could have used that experience to build a career anywhere. Why here? Why quietly? Why now?" It was a good question. But the answer, that took me a while to put into words. Because I needed to know if what I learned out there still mattered in here. I said, "In the real world, under fluorescent lights and clipboards and protocols. Not adrenaline and tense." Dr. Moore studied me for a long moment. "That world wasn't any less real," she said gently. "No," I replied. "But it was temporary. Survival work. What we did there, it was necessary. But I wanted to know if I could make a difference before the bleeding started. Not just during." Later that week, she pulled me aside again. This time, it wasn't for a conversation. It was for a proposal. "There's a regional training initiative being developed," she told me. "A new curriculum for cross-disciplinary emergency care. Trauma, field response, code gray scenarios. They're looking for field-proven methodology. And you want me to contribute? I want you to lead it." I laughed, before I could stop myself. It wasn't mocking, it was surprise. "Me? The instrument nurse?" She didn't smile. "Yes, you. The woman who built a trauma training program in a break room and taught half this hospital to stay calm when it matters most." I didn't answer right away, not because I didn't want to, but because something inside me was wrestling with what that meant. Leading a program meant stepping out from the edge of the room. It meant being seen. It meant putting my name on something. It meant no longer being invisible. That night, I walked home the long way, through the edge of downtown, past the shuttered fire station and the brick archways from when this part of Chattanooga still ran on rail lines and sweat. I kept thinking about those 14 patients in Carver Base, about how none of them knew my name. Just the girl with the gloves and the quiet voice who kept whispering, "One more breath, just one more breath," as she tried to buy them a future. And somehow, this felt the same. Maybe here, now, was the second chance I didn't know I'd been waiting for. I didn't say yes right away. The offer to lead the regional initiative sat in my drawer for a week. Every time I reached for a pen to sign it, I hesitated. Not because I didn't want to help, but because putting my name on something felt like closing a door I'd left open for a reason. One evening, after my shift, I found Tasha waiting by the supply room. "I heard," she said, smiling nervously, "about the new program. That's huge." I nodded, unsure how much had already leaked out. "You should do it," she said, eyes wide. "You already teach half of us anyway." I shrugged. "Maybe. I'm still thinking it through." She hesitated, then asked, "Can I show you something?" She pulled a folded note from her pocket, handwritten, a little wrinkled. I recognized the words immediately. Clamp. Rotate. Pressure. Now trust. I keep this in my scrubs every shift, she said. Because of you. Something caught in my throat. All I could do was nod. That night, I went home and opened the old duffel in my closet. The one I hadn't touched in years. Inside was a strip of faded cloth, used to tie surgical packs in the tent back at Carver. Stained, soft from time, hand-stitched with blocky letters. Field Unit 3, Carver, 09. I held it for a long time. It smelled faintly of dust and antiseptic. So many things had started there. The urgency, the instincts, the burden. But now, maybe, something else could start here. The next morning, I walked into Dr. Moore's office and placed the signed acceptance on her desk. If we do this, I said, it's about the work. Not about stories, not about me. She nodded. Agreed. And I want it open to anyone. Nurses, techs, residents. No walls. Done. We shook hands. And just like that, the breakroom nurse with the quiet voice and the invisible badge was about to help train a new generation. Across hospitals, across roles, across the old lines that used to keep people like me out. Our first official training session didn't take place in some grand lecture hall. It happened in Conference Room B, a space that still smelled faintly of whiteboard markers and burnt coffee. We cleared the tables, brought in old dummies from the trauma lab, and re-rigged the 4 lines for pressure tests. 16 people showed up. ICU nurses, 2 ER residents, a respiratory tech who hadn't taken a lunch break in 3 days, and Tasha, of course, with her notebook already open. I stood in front, hands in my pockets. No title, no PowerPoint, just a piece of cloth from my field kit sitting folded on the edge of the tray. I'm not here to teach you heroics, I began. I'm here to teach you what to do when the plan falls apart. They listened. I showed them how to assess bleeding by foot temperature, how to clamp a tear when visualization fails, how to create calm with nothing but your tone. And we drilled the 5 words. Clamp, rotate, pressure, now trust. Again and again, until it wasn't just a phrase, but a rhythm. At the end of the session, one of the newer residents, a guy named Felix, stayed behind. He was quiet, looked tired in the way interns always do. He hesitated by the doorway before asking, "Why did you become a nurse?" After all that, I thought about it. Because I didn't want a stage, I said. I wanted to be useful. He nodded, slowly. You're more than that. You're the reason I didn't lose my patient last week. I remembered the sequence. It worked. He left before I could reply. But I stood there for a long time after, thinking about that. Sometimes, being useful is the story. Word spread. By the 3rd week, the hospital had added a standing sign-up sheet outside the break room for the sessions. We had to move into a larger conference room. Maintenance brought in folding chairs. I started getting emails from hospitals across the city. But what struck me most wasn't the growth. It was who started showing up. Dr. Whitaker began sitting in the back row. He didn't say much. Just watched, arms folded, nodding occasionally. One night, after a simulation on crash C-section protocols, he lingered behind. You've changed how I run my, he said simply. Good, I replied. It needed changing. He didn't argue, just gave a tired smile. Even Dr. Bryce came once. He sat stiff as a board the whole time. When it ended, he approached the table, looked down at my field cloth, and said, "Where'd you learn all this?" "Up there," I said, "where things are messier." He glanced at the cloth again. "I've read every protocol we've used in trauma. I've never seen a 5-step sequence bring a room back that fast." "That's because it wasn't born in protocol," I told him. "It was born in panic." He didn't nod, didn't smile, but he returned the next week. At some point, the session stopped being mine. Other nurses started leading small parts. Tasha taught a segment on crash team coordination. Felix ran a case study on airway obstruction when suction fails. I stood in the background, watching them take the reins. This wasn't about me anymore. It was becoming a movement. 6 months after that long night in the OR, something happened I hadn't expected. The young woman we'd saved, the one with the ectopic pregnancy, came back. This time, she wasn't wheeled in on a gurney or surrounded by beeping machines. She walked in on her own, holding a tiny bundle wrapped in yellow flannel. Her daughter. The staff buzzed as word spread. She asked specifically for me. I met her near the elevator. She looked different, stronger, like someone who had found solid ground after the storm. "They told me," she said softly, "about what you did, about how close it was." I looked at the baby, then back at her. I just helped, I murmured. She shook her head. They said everyone froze, except you. She reached into her bag and handed me something small. A thank you card. Inside it was a photo, her baby, wide-eyed and healthy. This is because of you. I didn't know what to say, so I didn't say much. I just held the photo like it was something fragile. That moment said more than any award ever could. Later that night, I tucked the card into my locker next to the field cloth and the original note. No need for credit. Just need them to wake up. And now, one more word joined them. Alive. I still work at St. Marlowe's. Still show up early. Still lay out my trays with the same quiet rhythm. Still walk the halls like I'm part of the background, though fewer people overlook me now. But titles? They never mattered. I never took the instructor position full-time. Never wanted my name on plaques or programs. What mattered to me was the work, the calm and the chaos, the small decisions that buy someone another breath. And now, when I speak, people stop and listen, not because I speak loudly, but because they finally understand the weight behind the words. The 5 that saved a life that night. The 5 that kept echoing. Clamp. Rotate. Pressure. Now trust. They've become more than a directive. They're a way of thinking, a way of leading, a way of believing in the person beside you when seconds count. And it's not just my hands that carry those words anymore. Tasha runs her own sessions now. So do half a dozen others. They build on what I gave them, but they've made it theirs. Better, sharper, wiser. Dr. Whitaker includes the 5-step protocol in his trauma rotations. Bryce credits the method openly. Moore even mentioned it during a statewide medical symposium. They didn't name me. I didn't want them to, because that's not what this has ever been about. Sometimes I sit by my locker before a shift, just for a minute. I look at the photo of that baby girl, bright-eyed and full of a future, and I feel still. Not proud, not heroic. Still. The kind of stillness you earn only by moving through fire, dust, and noise. The kind that teaches you the difference between noise and signal, between attention and action. I don't need applause. I need them to be ready, to see what matters before it's too late, to speak, even when they're told not to trust themselves. And if that's my legacy, if I can give them that, then I've done my job. Not because I wore the title, but because I never needed one. If this story spoke to you, remember this. Not all heroes wear the spotlight. Some wear scrubs, carry steady hands, and wait quietly for the moment they're needed most. Evelyn Holt. Let me know if you'd like a formatted version of the full story or help turning it into a printable or shareable document.